We're just talking about the quarantine, the QFAC. That's short for quarantine facilities, guys. A little bit of your COVID 19 pandemic lingo breakdown there. Good morning, Doc.
Good morning, guys. Good morning.
So we were kind of just talking last night about the 18 positives that they caught in the quarantine facility, and you were saying it's two families, 18 total positives. Is there anything else you can tell us about this, Doc?
No, I think we're gonna find out a lot more, but I think that I'm very sure that this specimen gonna be sent to CDC for genotype to make sure that it's not any type of variants like the UK variants. But yeah, 18 and that's a lot. So it's proved to be very infectious somehow.
Right.
If this family coming in and stay in different room, but you know that's where the Q factor serves its purpose. But yeah, it's we're gonna sit and wait until the genotype come back.
Do you know how long that's going to take?
No, because it's difficult, so I'm not quite sure when it's gonna take. But the good thing about it is that these family members will be in the isolation hotel for the remainder the next 10 days or so. So they're not in the community. So it's good that it stopped at the Q factor and not outside. So it's something that again is you have to treat like a cluster,
Yeah.
but the one site and not in the community. So it's in the Q factor and now in isolation factor. So uh, we just going to sit and wait until the genotype come back.
Do you know what flight these guys came off of? Was it international or?
Yeah, that's a very little detail come out of that one, and I don't think no one have privilege for those the detail yet until they finish um, their research and investigation. So uh, I'm very sure also that all the people on that flight will be watched very carefully to make sure um, that they don't have no symptom. So it's something that we probably need to push for the new proposed guideline to come on board very soon. Just because we're going to require the 72 hours PCR testing prior to boarding to go to Guam. That's one way that we are sure that people on the plane does not carry the virus coming in. You're not going to catch everybody, but at least you have the pre-screening process before people boarding.
Doc, when we had you on last week, and I think Dr. Cabrera too, talked about the quarantine facilities being, in a way, like a border wall for the island of Guam, right? Do you think that this kind of shows how important the quarantine process is when we're catching, 18 positives? It really sticks out.
Yes, well, guys, I mean, for all the people out there that not all, but a few people out there are very critical of the Q factor and the way it run. I just tell them it really serves its purpose. I mean, we are where we are right now just because of Q factor. So I know it's expensive, but we live on an island, and the only way that the virus can get in is through the airplane, the air traveling. So it's not like you can drive from one state to the next. So you can control your border and you can protect your island by being quarantined. No, it takes 5 6 days in the hotel, but again, it protect the island, protect your family, protect the community. So as much I don't like the Q factor, but it does serve its purpose, and I know that a few people were very critical on say that 72 hours and you can go home and quarantine. But again, um, our economy get beat up right now. You can see the reason why, and this is the only way that we can go back to somewhat near normal, just like we are right now. If the Q factor is in place, we just have to modify a little bit, get people home earlier, have a very good home quarantine, that home surveillance program from public health. in place, and we do that, we will continue to improve our CAR score.
Doc, you know how we're sending the sample off to check if it's the variant, and they say the variants are way more contagious than the regular COVID-19. Are we concerned at all
Yes.
that these positives could have transmitted the virus to anybody who's staffing the quarantine, to anybody who's staffing the airport?
They are. I'm very sure public health are aware of the situation, and the Q factor, the facility, the personnel also take precaution, um, and they really track down that flight to make sure that the people on that flight have been monitored appropriately. It's very important because, like I said, 18, it raised your eyebrow a whole lot. It's just, there's no question about it. We see positive in the family, one or two here, but we never see that the whole family get infected. So there's something going on. And also, this is where, again, the PCR testing before you travel is so important because I'm very sure one of them will turn positive before they board a flight.
Doc, what about the guard members returning from DC? Or do you know anything about that? Were they quarantined? Are they on any type of exemption? Did any of them test positive? Because we got a tip
I
about
think
that.
the guard members come back from Washington is I think are treated as essential personnel. So I don't think they are quarantined. They're supposed to be home quarantine with restriction range of movement. So I don't think that they are in the quarantine factor. I'm pretty sure.
So in a situation like that, Doc, where if you're coming from a U.S. jurisdiction to Guam, we don't require a negative COVID test. So in the event of, like, let's say these guard members come back from Washington D.C., I'm assuming they're coming domestic, right, from wherever, Hawaii. But
Yeah.
is there any measure? Do they just, if they're deemed essential and they get to just walk out without quarantining, are there any measures in place to just like swab them to make sure that they're not bringing back any COVID cooties?
The guards sometimes the question is, are they flying commercial flight? Are they flying the MAC flight? Sometimes um, TDY, are they going to the MAC flight and not to the regular commercial flight? I'm not quite sure which flight do they take, commercial flight or military flight.
So if they come in on the MAC flight, are they swabbed upon arrival and tested?
I don't think so. That's not the protocol at this point. For essential workers, just like physician, before we come into the island, we had to submit the 72 hours PCR testing prior to arrival, and then we had to test one day after arrival. That's for the physician and the nursing staff that come back to the island. That's only for the physician and the nursing staff. I'm not sure the other essential worker have the same requirement or not, but for us, we have to be tested some 2 hours before arrival, and then 24 hours, after you arrive before you start seeing patient.
So you don't know if the guard members coming back have to have the negative test.
I'm pretty sure they don't.
So is that prudent to you, Doc?
No, I think they should be the same as any essential worker. They should be, tested before they arrive, and they tested 24 hours after they arrive. I think that should be across to anyone that deemed essential, and get the restriction range of movement letter from public health. They should go the same process. Because essential workers, depending on what we do, are also a risk of a carrier too. So I think everyone should be in the same boat.
Well, you're in a position to do something about it. So you think that this is something that you should bring up to the PAG, or
Yeah, we will bring it up. I think that one of the things that we really, I know we put a proposal for the new quarantine guideline a few weeks ago. I know it's the public health desk and they are under review, but they should be implemented very soon. We are in the second, no, first week of February already, so we should be implementing a new proposal for the travel guideline for CDC. Already have the guideline coming out the 26th of January. So we should be implementing the new guidelines soon as requirement um, before arrival and after arrival.
Doc? Let's talk about vaccination real quick. So, were you guys involved with any outreach? Are you doing any outreach coming up on the weekend? Because we had some of the mayors on, and that seems to be what's happening.
Um, yeah, we Dr. Akimoto want to do Tamuning homebound this weekend, so we will try to go through the homebound for Tamuning this Sunday. And we also, have the GDOE, the second dose on the 24th and 25th of this month to complete for the teacher and the staff. So that's and we also have to go back and finish the second round for PD and MTM in the next coming week or so. So those are the three villages that we're going to tackle and finish what we start with.
How's Dr. Akamoto doing?
He's doing good.
I was like, "Oh, there's a blast from the past." Is he still grounded?
He's still grounded. Just kidding.
No, you're not.
We keep him busy.
That's good. You got to keep him busy. When he doesn't have anything to do, that's when he gets into trouble. Oh man.
But yeah, we're gonna do Tamuning, so we're gonna work the mayor and hopefully roll out and finish the Tamuning this Sunday. I know public health have been doing homebound also,
Right.
Along with HSP. So we're gonna try to assist them this weekend.
Doc, I wanted to talk a little bit while we're on the subject of vaccinations because I was just getting some messages from a friend. Can you kind of talk about, and I don't even know if you witnessed this, but people who get the vaccine, even just the first shot, there's this kind of like sigh of relief where they think, oh, we're good now. Ooh, boy. Like I'm talking to my friend here and he's telling me he got vax yesterday and friends and family were like, oh, now we can hang out. We don't need a mask. We don't, you know what I mean? So just let's say, for example, you just got your first vaccination shot. What types of protocols and preventative measures do you need to do to keep yourself safe until you get the second shot? And then after you get the second shot,
Yeah,
what else do you still need to do to
we
keep
need
them?
to
Go ahead.
yeah, we need to put a lot of education out there for people to fully understand that the vaccination, the main purpose of it decrease the risk of you being in the hospital and also decrease the death. Okay, that's all it does. It tries to prevent you from being admitted to the hospital and also prevent from dying. But it doesn't prevent you from catching the virus. You're still going to catch them, and that's the most important part. People gotta understand that getting the first shot doesn't mean that you're going to drop your mask and run around and as normal as before. Boy, you're going to be very dangerous just because you're going to catch the virus, and then you're going to carry on to your family and your friends, your community. So you really have to still, use your mask, social distance, and protect yourself. So there's a lot of education out there should be there, and something that I think public health and the government have to put the message out to people. After the first shot, you're only 50% protected somehow. After about a week to 10 days or so, and you got to get the second shot to get to 95%. But again, try to prevent you from catching the virus, but you still can catch it. So, you got to use a 3W still, and you cannot drop that. That's very important. Again, even after we get everyone into the herd immunity, we still have to protect ourselves and we still had to do a lot of testing because I tell people that don't want the vaccines, and when you put yourself in a big risk because the people that have the vaccine will protect themselves. They won't get that sick, so if they catch the virus, they're gonna pass on to you because and you're gonna be really sick. So for people out there that don't want the vaccine, you just to me you put yourself at a huge risk because now that the people around you are protected, they might carry the virus and the very mild symptom, and they're gonna give it to you. So I tell you, if I have my chance to get a vaccine, I tell people to get it. There's no contraindication not getting them. You can have three choice now. You have the Pfizer, you have the Moderna, and hopefully we have the Johnson. So pick your choice. They work the same. The Johnson is not an RNA type of vaccine, but they don't work quite as well. So if you worry about RNA vaccine, then just get the Johnson. It's available, but get something to protect yourself.
When are we getting the Johnson & Johnson vaccine? Because I talked to somebody yesterday who's like, oh, I'm waiting for the Johnson & Johnson.
I don't think they have the EUA yet, so they still need to approved by the FDA before they can give it out, but I think it's going to be a few weeks out.
Okay. So what Doc is referring to, the EUA, is the emergency use authorization, which the FDA gives to companies to allow them to issue their product, or in this case, their vaccine, before it goes through all the crazy approval things.
Yes.
Go ahead, Doc.
So if you get the first dose, make sure that you look at your card, and make sure you get the second dose almost on time. I know you can get it 2 or 3 days earlier and 2-3 weeks later, but I wouldn't wait. If look at the date, and if you see the date coming up that you're supposed to have the second dose, look at the newspaper and look at Facebook and see when and where to for the second dose and try to get them. So don't be forgetful and forget about second dose. It's very important for you to have that. If not, you're gonna stay at 50% or less. So I would get the second dose and don't miss it.
Doc, so you're basically saying that we need to come out with some cool videos that say, after you get your shot, don't do this, don't do that, and maybe get what's the Carabal's name?
Yeah, I think
Kiko.
Kiko
the Carabao.
Yeah, and you guys did some great videos. Some of you might come up with something there, Chris, Jason.
We're here to help. We're here to help, Doc.
We need help.
Yeah, we do.
You got to pass out the message that people will not, will not drop their guard down.
Doc, go ahead. The bars, right? So we had Crystal on, I think Friday. She said that Mary Rhodes was asked to come up with some protocols to open the bars, but they actually already have done them ever since way back. So what's your opinion on that? Are we ready to kind of reopen the bars?
And I think that we have to look the guideline from the bar to make sure that that we are comfortable with the guideline. I think that if they have the guideline, they should be allowed to open sometime. You cannot shut them off the whole time, because we shut them down for so long already. But they need to have a strict guideline. I don't see the guideline yet, so I'm curious to just take a look and see what type of guideline do they have in the bar. But if they police themselves and make sure that all the bar follow the guideline, just like the school does, then I think that in the near future they should be able to allow to be open. You can't really shut them out completely. Right now, I went to some place to eat, and I mean we sit outside and look like the people are drinking, outside. So, but they social distance themselves on those type of environments. So, I think that as long as the bar has some very strict guideline and police themselves, because all you need is one bar to break the rule, and the whole industry got affected. So they have to police themselves.
Hi, Doc. I wanted to follow up on some of the questions that Chris had asked regarding the 18 individuals in the QFAC that had tested positive for COVID. You mentioned they were two families, correct?
I think so. Yes, Sabrina.
Did they come in? The two families come in on the same flight?
Those information is not available for a lot of people yet, Sabrina. So I myself don't have the full detail for those two family. But again, I mean, I'm sure that it's going to come out soon, and I'm very sure that those family specimens have been sent out. 100%.
And so we don't know if they came on the same flight. We don't know where the originating flight is. And wow, it just seems like if it's that serious and that, I mean, that large amount, that more information would be provided to the community so that people have an idea. How serious
especially the flight number and the people on that same flight. I would agree with you that those information should be out to public. So if I'm on the same flight, I would be paying more attention to my symptoms to make sure that if I have symptoms, I go, I seek care from my physician right away.
Right.
So I think those things should be published out to the community, so that way people on the same flight would know.
Thank you, Sabrina.
What about when they arrived?
Right.
Like, nobody knows how long they had been in the QFAC before they started exhibiting symptoms?
No. Those things nobody know yet.
Doc, you're the head of the PAG. I think they would tell you.
Do they have age ranges though of the people that were part of the families?
Yeah, I think what we will do is I'm sure that there's a push to let public know more about some detail on the flight. Again, the more detail public know, especially on people on the flight, so that way everyone can kind of really pay attention to their symptom. It's really helpful that the more people know about it, especially people on the flight, the better for the community. So I will try to push to see if we can get more detail out there for people to know. There's no privacy in this one. I sit in the plane for UA, arrive on Thursday. There's no privacy. There's no name, but at least I know that I'm on that plane.
So we don't know either if any of them are children or age ranges, or like how many between the two families. Like there may have been 10 in one family or 8 in another. But each one of these people had individual rooms?
I think from what I know is that there's two family in two different rooms.
The entire family?
Yeah, I'm not sure how they arranged that one. Is that kids or adult? But that's the only thing I know is there's two different families and they different room.
Wait, all of them are in different rooms, or you're saying two families?
Yeah,
and
all of
two
them are different room.
Oh, all 18.
Yeah, but they are the family, so that means they kind of have a close interaction with each other because they're family.
18 different rooms.
No, I'm not sure how many rooms they are, but again, the nature of the 18 is concerned, because I mean that this thing is very infectious for some reason.
Right.
The current strain, we don't see that many the whole family positive like that, not that fast. So again, this is going to raise a lot of question on how many people in the family can stay in the room, and also the genotype of this infection. So we just have to wait, Sabrina. But I think that the one thing that I really probably encourage public health to do is release more information on the flight number and the date, so that way other people can pay attention to it.
Right.
I'm just curious. Does public health track, for example, if there was a positive in like room 13? I'm just throwing out a number, room 13. And then did they mark that, okay, somebody was transported, they ended up being positive in room 13? And then when somebody else comes in, I mean, I don't know how this works, but somebody else comes in and lo and behold, they test positive and they were in room 13. You know what I mean? Like, are they keeping track of the rooms where positive cases are or were?
I'm very sure there's some sanitizing procedure, Sabrina, that if someone turned positive in a room, that room will be sanitized heavily just to make sure that it's safe for the next person to come in. Just like anywhere else where we in the grocery store or anywhere else, they close it down, sanitize it. And I know the Lusitani, I know the GM, they have a very strong team there that actually do a lot of sanitizing procedure. So I'm very sure that room are very well cleaned before the next person come in. They have their own sanitizing team.
I'm just asking because we've been seeing and we've been hearing, a lot of the, we're seeing an increase and an uptick in positive cases from the QFAC.
Yeah, I think the increase uptake in the QFAC is because in the state they're still very much in the red zone. There's a lot of positive there. So as you travel from the state to Guam, the chances that you will be positive is somewhat much higher than in the past. I know from a few of my patients that travel from the state back to Guam. Yeah, quite a few family turned positive. So when you travel the state to here, yes, there's a higher risk of positive just because of the current level of positive in the state at this point. So there's a big risk. So I think it's very nice that we try to implement that 72 hours testing prior to boarding. And again, we will push for that to be implemented very, very soon.
Regardless of what, regardless if you're coming from the mainland.
Yes, you have to be just like Hawaii. They require the testing. I think that it's about time for Guam to implement that one. Again, the new proposal that the advisory committee have come up already is up with the level of public health to implement it. So I would ask public health to go ahead and implement it very soon.
So regardless if you come from an international destination as required by the CDC, the PAG is now recommending that it doesn't matter where you are coming from. If you want to come to Guam, you got to have that 72-hour negative COVID test.
Yes.
Okay.
Or
especially from the U.S.
Right.
Because of the variant, right?
Yes.
And so for these 18, you said that it's been sent off island to do the genome sequencing testing. What about previous positive cases from the QFAC? Have there been any instances where it's been sent off island for this genome sequencing?
Yeah, so far, over the thing we sent out, they have nothing coming back as the variants yet, Sabrina. So far, so good. If not, you hear that in the news already. But so far, we have nothing variants coming in from the U.S. yet.
But those, like I said, from the QFAC, they have been sent off island for this particular type of testing, and they've all returned negative.
Well, I don't know that for a fact. It's only turned negative, but so far, if it's positive, it should be all over the news already. So I would presume that it's all negative so far. But again, in the past, we let people in a positive and isolation factor that can do home quarantine or home isolation. But now 100% are positive, they would not be allowed to go to their home isolation.
So is that information that would be included in the Joint Information Center reports that they would be that they are because you have the PCR test, you have the antigen tests. Should that be included so the public knows that okay, so we are doing this genome sequencing, so we know okay they are testing for the variant and it's negative.
Yeah, I think that I know the JIC includes something in there, but I don't think that they report as negative for the variant. So that's something Crystal, I think, is responsible for it, and I'm pretty sure they're going to put some more information there for the people to know on the JIC that hey, we send out for the genotype testing at CDC, how many come back negative for the new variant. So I'm sure they're going to include that in the JIC so people are much more aware of the situation. Because everyone worry about the new variants at this point.
Yeah, and it also shows that yes, we are testing, we are, containing or trying to prevent it from coming into Guam.
Yeah, but again, that's our protection of our border is a Q factor. So hopefully it stopped from then. But I get your point that the people that work the Q factor that potentially get contaminated just because it's more infectious than the current COVID-19 at this point.
Yeah. Well, thank you, Doc.
Yeah. Appreciate it.
You're welcome, guys. A lot of info there. Another one, again, so the travel guideline for the PCR testing to go from Guam to the U.S. Again, I know it's very confusing, but guys, but people need to know that if you transit through Hawaii, if you go to Texas or go to Florida and you transit through Hawaii, you do not need to have the PCR testing unless you want to waste your money and pay for it. You don't need it. You need to sign up on the website through Hawaii, say I'm transiting, and get the confirmation there, so you don't have to wait. But you don't need to have a PCR testing flying to the state through Hawaii. I know there's some confusion on going to Japan, but I think that United is trying to fix that confusion. But most likely, you do not need to have a PCR testing go through the reader to the U.S.
What about if you're coming to Guam from the CNMI?
I think from what I see from CNMI, they don't have to have that testing, Chris. CNMI are pretty low rate and they do a very good job and protect the border, so their CAR score is really, really low.
What's their CAR score?
I think almost like 0. I don't think there's not much of community spread in Saipan at all. They protect the border pretty tightly.
They don't have a CAR score, Doc. That's the Guam thing.
Yeah, but if they're gonna put a CAR score there, I think all the positive in the Q factor, Chris. Community-wise, I don't hear anything positive in community.
They haven't had any community spread since like 1980 or something. Yeah. Something crazy. Their cars, if they had a CAR score, it's probably like negative 20.
They actually very good. So again,
Kevin Bautista is quick to tell us how good they are.
Yeah, pretty much. We still haven't got our blueberry bread though.
Okay, so don't get the PCR and waste $150, $200 to get PCR testing to go to Hawaii to the state. You don't need it. I mean, no. If you want to do it, but that's a lot of money.
Well, thanks, Doc. Okay. We put a message out to public health. Hopefully, we'll get more info on these positives. But we appreciate you sharing what you know with us and our audience.
Okay.
Thank you, Doc.
Day, guys.
Okay, you too. Be safe. There you go. 7:45. So that was a very interesting conversation. It looks like we need more info from public health on these 18 positives that they caught in the quarantine. There's something else that was interesting. Was he said that the guard members returning from D.C. would be deemed essential personnel and wouldn't be tested for the